But I'm going to stick with the medical theme for now because the latest GP appointment figures have revealed that more than 5 million people like you, were unable to book appointments in the month of October. Now, the findings, it's important to say these are by the Labour Party, but still, show that 13.8% of people did not get an appointment the last time they tried to book one, with the number of failed appointments having doubled since last year. As ever, there are layers to this catastrophe, and to pick through them is Dr. Shirin Lakahani, who's a private health specialist. Look, thank you very much. Great to have you on the show. First things first, public health in this country. Are the public right to think that GPs aren't working hard enough?
I think that's not the case at all. I think the problem is that we don't have enough GPs in the country. We don't have enough healthcare workers in general. We've had a lot of people leave the profession as well due to the working conditions, particularly after the pandemic and the stress caused by that. The government haven't met their promises of providing more GPs. They promised an extra 6,000. They've already said they're not going to meet that target. And demand for healthcare has gone up as well. So it's a perfect storm, really. Yeah, I understand that. Again, just reading some of these facts and figures, obviously public health is massively affected. People who, let's say, can't get a GP's appointment are then maybe getting more sick and putting more of a burden on the NHS. But when we're looking at strikes, for example, with NHS workers or hospital porters or paramedics, 999 call handlers, it's interesting that the care worker sector doesn't appear to be striking. They were absolutely battered during the pandemic. I know GPs aren't striking, but what is so unattractive about being a GP when you compare it to other elements of the medical profession? It's not just unattractive about being a GP, but there are a lot of pressures on them. They're the first port of call for the public when they need medical assistance. There's immense workload for GPs. There's a lot of red tape and bureaucracy, and their funding's been cut as well, so they can't actually meet the demand that's needed from them. Just on that, sorry, I'm just reading here. It says the most common reasons that patients were unable to secure a GP appointment were because practices were not allowing them to book too far in advance. That doesn't appear to be red tape. That appears to be the fault of practice. And then you read headlines. I was doing a piece on this earlier on last week, I think it was, about GPs wanting to just work 9 to 5 and not weekends. Is that red tape? Well, you're looking at working conditions, and at the moment, GPs don't work 9 to 5. They work much longer hours. But they want to, don't they? Working at weekends. There are on-call centres. So the issue we have is that there isn't enough GPs to meet the workload. There aren't enough appointments available. The reason that people aren't being able to book appointments far in advance is because of the high DNA rates that occur when these appointments are booked that far in advance. And the GPs need to deal with what's urgent. So it just makes it really, really difficult all round. OK, so how do we solve the recruitment crisis for GPs then? Because every single other aspect of the NHS walkouts appear to be around pay. I would imagine that the general public would have a lot less sympathy for GPs when it comes to pay than they would for, say, a staff nurse. Is that how we sort it? More money? It's not just a question of more money. There is a lot of other things around it. So the workload is far too high at the moment. The number of patients that GPs have to look after per head is just ridiculous, just because of the shortage there is in GPs and also other practice staff. It's the same throughout the NHS. It's poor working conditions, poor retention of staff. Not enough of them. Just quickly, absolutely. I take exactly what you've said there, but I would be probably not doing my job if I didn't ask you this question. I've just read out your title that's been given to me here, which is Private Health Specialist. And one of the big concerns for a lot of people is, well, my GP is only available a few days a week, then they go and coin it in the private sector. Do you do that? I'm not a private GP. I actually work in a very specific field in the private sector. Do a lot of GPs do that? Is that a lot of GPs... I can't say. There are a lot of people who were previously in the NHS who have left the NHS to work in the private sector for various reasons, and poor working conditions is probably the biggest one. I think, because I think that's what a lot of people struggle to get their head around. Patients, struggle to get their head around. If people go and, start working in the NHS, maybe use that as a bit of a leg up and then get into the private sector, some people maybe think there's something a bit rum about that. I don't know. But, hey, there we go. Dr. Shirin Lakahani, thank you very much. Private health specialist.